All right, Corey and Kevin, if you guys are ready, I think you can start anytime.
All right. Um, Good afternoon, everyone, and or good morning to some of you as well. My name is Corey Earl. I am the president of People First of Canada. I want to thank each and every one of you for coming on today. And let me just remind everyone to wish everyone a happy St. Patrick's Day. Please stay safe as we go on this. Lord, I'm proud of our organization. I'm proud of the webinars that we've been able to do across this country. Um, and I'm also proud of the work of the members that you have been doing right across this country. We exist to represent and to advocate for those who are labeled with an intellectual and developmental disabilities. Sometimes we don't get to see all your work, but we know the great things and important things that you are doing back in your communities. The first webinar series is People First Project that was created specifically for you. Take off my glasses for a sec so I can see. This is our fourth webinar, believe it or not, that we've hosted this winter, and we've tried to bring information that is important to all of you. So far, we have talked about mental health, a critical piece, fitness and nutrition, questions about the vaccine. And today, it's all about keeping ourselves safe and healthy as we continue to move forward during this pandemic. One of the things that I'm going to talk just briefly about you, and certainly I used to be a screener of long-term care, but now on the floor, long-term care is, I used to ask the questions about personal protective equipment and making sure that all staff knew how to take it on and take it off. I was tested one day on how to take off my equipment by my supervisor. I must say, when you're thrown on the spot, you kind of go freeze. So I threw back at her and I said, "How do you take off your protective equipment?" And she said, "This is the way I do it." I said, "You're actually wrong." I said, "Maybe I should go to your boss and tell them that you failed on that part." She literally went downstairs and looked at our screen, and clearly she laughed and she went, "Oh, you're never going to let me down. No, down this." So it's really important that PPE on how you put it on and how you take it off. One of the biggest things that you need to do is you need to perform hand hygiene. That's number one. And hand hygiene is actually 15 seconds. So it's really important because when you do it like this, it doesn't cover all the surfaces. Trust me, we knew when we had the glue thing that went around and showed on how much germs we actually had on us not so long ago. So it's really important to you. That also, put on your gown is your next one. Put on gloves as well. Put on a mask, or in some cases, if there's N95 as well. And put on protective eyewear. So, and that's, what it's eye protection glasses, but also shields as well. A lot of places that are wearing those. It's really important to do that. Now, the question is how do you take it off? Easier said than done, we just rip it off, but that's not the case because you want to try to prevent from the germs aspect. First of all, you need to remove your gloves. In order to, and then you remove your gown. And then you perform your hand hygiene again. Again, that's really important because you just touch your gloves and you just touched your gown. It's really important. And the next one is remove your eye protection. So make sure that you remove your protection, remove your, or it being a shield.
I've lost Corey, Monica.
Pardon me?
Oh, you were lost for a second.
Okay. So remove your eye protection, and then remove your mask or N95 as well. And then finally, what you'll do, because now you've taken all that off, you perform hand hygiene again. Again, that's really important that you do that. So that is how you put on and take off your PPE. And today we're going to hear directly from people's experiences with keeping safe. And with that, I would like to introduce your host today, for which to do so is my good friend Kevin Johnson. who is the president of People First of Manitoba. So today, I do apologize. I do have to run in about 20 minutes to go and work at the facility, but I do know that today will be a great conversation. So certainly learn a lot. Thanks.
Thanks so much, Corey, and welcome everyone. If you are just joining us, the topic for today's webinar is staying safe with a mask and social distancing. We have our French translator, Franck, with us today. Thanks, Franck. Everyone, please hit the translation button at the bottom of your screen and then hit French. If you want to listen in English, please hit the English button. We are recording this session today. If you do not want to be on camera, please turn your camera off. I am thrilled to have all of our guests here today. We will be hearing from them all soon. But first, I'd like to introduce Amanda, a member of People First in Quebec. She has agreed to share her experiences with us. Thanks for joining us, Amanda. I know you speak French, and the interpreter is going to translate into English for us.
Thank you, Kevin. Thank you for having me.
Go ahead, Kevin. I think she heard you. You can go.
Oh, sorry. How are you doing today?
I'm doing good. There's some days that are harder and other days it's a lot easier.
How did COVID affect you when it first started?
I was anxious, stressful, worried, uncertainty, because we didn't know what was going to happen.
Did you have to quarantine or stay at home?
I had to stay at home and work from home.
How do you stay positive?
I write in the notebooks. The Wednesdays I do our Zoom Bien-être, where we learn to meditate and we do activities to help us relax from all the stress of COVID and not being able to see friends and family and live normal lives. And meditation helps a lot when you just let your mind be free and peace and quiet.
What did you think when everyone had to start wearing a mask?
It was a good idea at first. I did not know how long I would have to wear a mask, and I don't like it for long periods of time because I have extremely sensitive skin, and when I wear it for long periods of time, my skin can't breathe, so I have to take off my mask because it's very sensitive and it scratches, and I only want to. Yeah, it's not comfortable wearing it for long periods of time.
How did that feel for you?
At first, it felt weird having the masks on, and then I'm used to it now. But it's not fun. It's not pleasant when you have to wear it for long periods of time, and then you sweat, and then you have to put it back on. It's like you don't feel like putting it back on, because all the germs are left in your mask. Then you have to wash it.
Yeah. What are you most looking forward to doing when the COVID is over?
Reconnecting with family and friends, and no more wearing a mask. I'm going to be happy.
Thank you, Amanda. Our Our experiences with COVID across the country are so different and also the same. We all have challenges and ways we stay positive. Next, we are going to share a video from People First member Danny. He lives in Manitoba and he helped us by sharing his story. Let's take a moment to watch the video together.
He understands that there's things going on out there that it's not safe.
I find that he is bored because he's used to doing, going every day to the city and being around people and stuff, and now he's not.
He really does miss going to church. He enjoys going and giving his envelope, his tithing. He enjoys going to see all of the people that he's known for his entire life, and he misses that.
We try to get him out for walks, and he used to go shopping every Saturday for groceries, and he goes to work and he goes and gets the mail, but all that is totally different now, right? He doesn't seem to mind wearing a mask. He doesn't show any signs of distress or like it bothering him, so it probably does because I know it's not comfortable for any of us to wear the masks. He likes to be around people, but at a distance. Like he likes to go do things, but he'll never ask to go do something, so it depends on how you word it to him. If you say, do you want to go for a walk? He'll say no. But if you say, well, let's go for a walk at 12, then he'll be ready to go. But he does prefer a distance. Like if he can go down to the basement by himself, or he always wants you to go to the staff room and he prefers the door shut. There's very limited things that we can take him to go do at this time that are safe for him. Work's been taken away, church has been taken away, grocery shopping. He's lost pretty much everything that he normally would do.
I'm good. How are you? Good.
The biggest thing he's going to look forward to when this all ends is having his routine back and his structure of his daily routine of getting up, going to work, coming home, just being able to have that routine back that everybody is looking forward to, myself included. Who doesn't want to have that routine?
What a great inspirational video. Thank you, Danny. We appreciate that you helped us make that video. Now we're going to hear from Stephen out in Newfoundland. Hi, Stephen.
Hi, what's up?
Not much. How are you today?
I'm doing great. I'm just a little bit tired, but hey.
Yeah.
I'm doing fine. I'm doing fine.
Awesome.
Sorry. There's two Stevens.
Oh, sorry. I was like, oh, maybe
Stephen
me.
Westcott. Sorry, Stephen. You would be
Oh, okay,
interesting
okay.
too, I know.
Yeah.
Stephen Westcott, you are muted, sir.
Sorry.
It's okay. Stephen, can you unmute?
Whoops.
There we go.
Yes. Sorry about that.
Okay. I'm great. How about you today?
I'm good. It's a beautiful day. Seeing the sun and stuff like that is good.
Okay. How did COVID affect you when it first started?
My nan passed away in May, so we couldn't go visit her, and then she gave up because she couldn't see anybody and just couldn't hang out with my friends and do my normal activities.
Did you have to quarantine or stay at home?
I had to stay at home.
Okay. How do you stay positive?
I stay positive because I know that there's a light at the end of the tunnel, and I get to travel for my bocce tournaments in Ontario and stuff like that.
What did you think when everyone had to start wearing a mask?
It was a struggle at first, but when I got used to wearing it, it's second nature to me now.
How did it feel for you?
Like I said, it felt different because we were able. It felt different because once we didn't have to wear a mask. We didn't have to wear a mask and then go to wearing a mask. I'm not used to having a mask on my face. Like I said, when we got to change our routine to go from wearing a mask to not wearing a mask, or not wearing a mask to wearing a mask.
What are you most looking forward to doing when this is all over?
Traveling for my bocce tournaments.
Thanks, Stephen, for sharing. That was great to hear from you.
You're welcome.
We appreciate it.
Thank you.
Right now, we are going to hear from a nurse named Angela Gonzalez. She's going to share some information and take our questions. When the time comes for questions, please raise your hand, or you can type your question into the chat box on the side. Please remember to stay muted so we all can hear her speak. I'm going to let her introduce herself. Welcome, Angela.
Thank you, Kevin, for such a lovely, warm welcome. And I'm very, very happy to be here and to meet everyone. Thank you so much for having me as a guest today. So as Kevin said, my name is Angie, and I'm a nurse, an RN, based at Surrey Place, which is an agency in Toronto, Ontario. And we have clinical services for people who have developmental disabilities. So I'm very privileged to have that role as a nurse working in the community. And I'm happy today to talk to you about personal protective equipment. And if that's okay, I'll share the PowerPoint. Okay, hang on a second. Everyone see the PowerPoint? I hope so.
No.
No.
Oh.
Oh, there we go.
Okay. Let's see if this makes it better. I think my computer is just very slow because I'm getting that circle. Okay. Is it sharing the okay, good. Okay. So yes, today we're talking about personal protective equipment and some questions. So things like, how do viruses and diseases spread? What is the proper hand washing technique? Why does it take 20 seconds? And how do we use our masks? Do they all work the same? How does this personal protective equipment help us? Why are we doing social distances, and how long are we going to have to do this? So some of it, Corey talked about really well. As we began, he went over some of these things, and he talked about putting on and taking off your mask. So those are things we'll get more into. So the first thing is, how do viruses spread? Viruses and diseases. And you can see here the picture of someone coughing or sneezing. And you can see here that in the visual that there's little droplets that come out that we won't see with our eye because they're so tiny. It's hard to see them with our eyes. But when we talk, like I'm talking right now, or when we sneeze or cough, these droplets come out. And depending on how strong we sneeze or cough or talk, and the droplet, the size, it can go a distance. And this comes back to why with COVID, we have to stay a certain distance apart, because these droplets can move a certain distance before they fall to the ground, for example. And the other thing is droplets, if we sneeze into our hand, or if we touch surfaces, if we touch things like the doorknob or the table, and it's got something on there that's a germ, and then with our hands, we might touch our face, our nose, our eyes, and then we can pick up that germ and get it into our bodies. So that's why Corey was also talking about hand washing being really important. And there's a picture there of someone drinking. So sometimes some types of germs can be in things that we eat or drink. And our body has a way of protecting ourselves. So even though there's germs out there, and we will always have the chance of getting a germ into our bodies, it's okay, because we also have something called an immune system. And our immune system protects us inside and fights against these germs. So when people get sick, there's a period of time that you're not feeling so good, but then you can recover because your body has that system to protect and try to fight against the germs. So this just shows, again, the same thing, the spread of the germs and how they can be on our hands, they can be on surfaces like the table, like doorknobs, and they can also be spread if we are sick ourselves and then we cough or sneeze, and we can spread it to other people that way. So then below each of those ways of spreading the germs, you see there's ways of protecting against those germs too. So below the contact part would be hand washing or using hand rubbing, the sanitizers, the alcohol-based sanitizers. Below the contact piece, right now for COVID, that's why we have to protect ourselves and other people by doing social distancing for now, until people are well enough again, or there are vaccines that can help us to get out of this, what we're calling a pandemic. Then for the droplet piece, the coughing and spreading it through your mouth, this is why we protect ourselves and other people by wearing masks when we're in public, or if we're inside, but we have to wear the mask to protect ourselves against other people and to protect other people from us if we're carrying something. I hope that helps. So why do we have to wash our hands for 20 seconds? Why do they say 20 seconds? So you see in the picture there, what Corey also talks about so well is that when we're hand washing, we have to first wet our hands, then we take the soap, and sometimes you leave the tap running because you don't want to have to touch the tap again. You then lather with the soap and you wash and try to get all the creases in your hands. And we need to do that for 15 to 30 seconds. So a way of timing that is to sing a song like the Happy Birthday song. So they've timed the Happy Birthday song. And if you sing it twice, that should be good. That's about 20 seconds. And it's also good because you can make variations of the Happy Birthday song. And it's fun. It's a way of stopping and being mindful, being in the moment, and singing a lovely song and having enough time to wash our hands properly. So do others have songs that they like to sing that might work for this, like when we're washing our hands? Do others have any songs?
If you're happy and you know it.
That's a good one. Yeah, I love that one because that's actually, we're using our hands then too. If you're happy and you know it, clap your hands. Yeah, while you're washing. That's great. Any others? Any other songs we can think of? I think that's a good one, actually. Yeah. I can't think of any other, actually. But yeah, so the Happy Birthday song is the one that I usually use when I am washing my hands for 20 seconds. So I hope you're seeing the PowerPoint again. Good. So how do I use hand sanitizer? You see everywhere there's hand sanitizer. They're safe from research. This is what we use in the hospitals a lot, and they've been safe. You apply a little bit, drops to your hand, and then you rub your palms, just like when you're washing your hands, except you're using the alcohol sanitizer, rubbing everywhere, trying to get into the creases. And the important thing too is to wait until the hand sanitizer dries so that your hands are dry. And then your hands are clean. So why are we using masks? We talked a bit about it's preventing those droplets. And how we use it is first we have to wash our hands because we want to make sure our hands are clean. And then we try to touch, I have my mask here. We try to touch just the handles as much as possible because we don't want to touch inside the mask that goes against our nose. So as much as possible, we're holding our masks by the handles as much as possible. And when we put it on, as you see in the picture, some masks have the metal that you can make sure that it's fitting over your nose. And we cover our nose and mouth. And we try not to touch the mask as much as possible. And then when we're taking it off, the same step is that we want to make sure our hands are clean before we touch the mask again to take it off. And if it is a mask that you're not throwing out right away, if it's something that you're going to wash, for example, you could put the mask in a Ziploc bag and keep it open so that there's air, able to get in. Or you can use a brown bag to store your mask in. And if it's a disposable mask, when you take it off, as soon as you take it off, you want to throw it directly into the garbage. Because if we take off our mask, if you think of it like a tissue that you sneeze into, you wouldn't want to put that tissue on surfaces so that the tissue then makes those surfaces also not clean anymore. You'd want to throw that directly into the garbage. So those were the steps we talked about with putting on your mask and taking off your mask. We wash our hands, we hold them by the handles, the bits that go around our ears. We put them on and we make sure there's a good seal over our nose. And then taking off, we wash our hands again, or we hand sanitize. And then we take it off using the again, holding from the elastic parts that go around our ears. And we can wash our hands again after that because we've touched our masks. So are they all made the same? Are they all working the same way? What do people think? Are all masks created equally?
I would say no, because some of them, like the cloth ones, they're not. Sometimes they get worn out fast, and that's really the only type of mask you have. Like I got both, so I don't have to worry. But some just have the material ones, and I don't. Some of them are good, but some of them aren't, and so I'm not sure what protection we're giving or even getting.
Right, that's good points. Yeah, those are good points because you're right. There are different masks. There are cloth masks, and then there are the disposable masks, like the one I have here. They're shaped differently. Some have a cone type shape. Corey mentioned the N95, and then there's some that are called surgical type because they look like, you know, the doctors that do surgery. So yeah, there are lots of different types. And how do you choose a mask? Well, we don't need, we can make it simple in that the mask that we choose needs to, ultimately it needs to fit our face well. So we need to have a mask that will go over is big enough to go over our nose, cover through the cheeks, and cover our mouth, and be comfortable around our ears. So some masks have an adjustable tie that you can adjust, and everybody's face is different. So that's why there's a lot of there are a lot of options, a lot of choices for people to make on what's the most comfortable mask that fits their face, their specific face. I have a long face. I don't need a very wide mask because it's long. So I would say first thing is you want a mask that is going to be comfortable. The mask needs to have at least 2 layers. They're saying now at least 3 layers is even better. So the cloth masks have at least 2 layers usually, and they're made out of cotton. That is a thick woven type of cotton, and breathable. And also the surgical masks are made with layers that we can't see with our eye, but enough layers that will protect us as well and also be breathable. And we want to make sure that the mask is big enough to cover over your nose, and that it can seal, it can fit snugly. So sometimes people are selling masks for children, and it may not be shown, okay, this is a child's mask, but you'll see that it's small. And that's not the right one for us as adults. We need the one that's an adult mask. And the good ones also may also have a wire that we can pinch over our nose to get a better seal. So there's lots and lots of options. And one of the things we could do is we could also talk with our healthcare team, the doctor or the nurse, and show, if we can do video with them, show them how your mask is fitting, if we have any questions. And it's really helping us to be able to protect, to put a barrier between us and, for example, COVID germs that can be spread through through being close to somebody. And sometimes we need to be closer to people. Like when we go into the grocery, we might not be able to avoid walking past someone and being a bit close. So that's why we have our masks on for now. And when you go into medical offices, you might need to get close to somebody who's treating you, but they also have their masks and protection, gloves, and also a face shield. Usually in the medical offices, they have the mask and the face shield. So last thing is the social distancing piece. It's 6 feet apart, again, based on the spread that they're seeing with the COVID germ. And just that we need to really keep doing this and wearing our protective equipment right now, because not everyone has been vaccinated. Some people are not able to be vaccinated. And until there's enough safety, we have to keep doing this and wait for Public Health Canada to give that official direction that we can stop. And hopefully that will be this year. I'm very hopeful, especially with the vaccines being available. So thank you so much for having me. I'm wondering, I went over a bit. Any questions?
I have a question. Can I ask a question?
Sure.
I put it in, thank you, first of all, thank you very much. That was a really good presentation. I put it in the chat, but I wondered what your thoughts were on that. I heard this morning about the disposal of masks, and they're saying now they're equating masks to the same sort of harm to animals like the rings on can packages. Mm-hmm. And so I was just wondering about that. Like, and I've thought that every time I throw my mask out, I'm like, what am I doing to the environment by throwing this in the garbage? What about the animals that are going to be getting caught? And we all know how awful that can be for animals. So is there thoughts, advice? What do we do?
Yeah, that's a really, really good question. So with the proper disposal systems, if it's put into a good garbage collection system, then there are many things that we put into the garbage that can be harmful to animals. But the way our systems work in collecting the garbage in proper garbage bags, the right garbage bags, and being taken to the right garbage dump, for example, not getting into the water system. So for example, if people are throwing their masks not in the garbage and the wind takes it and the mask then ends up in rivers and lakes, then you're right, that's a really good point, that there's elastic that animals can get caught in. And that's why it's really important to dispose of them in the right garbage disposal system. There is a lot, you're right, a lot of PPE being disposed of. But that's why some of these disposable masks might be something we use, or we may prefer the cloth masks that we can wash and not have to dispose of so many. Unfortunately, healthcare providers don't have that. For medical, they have to use the disposable ones.
Okay, thank you.
Really good point, Shelley.
Angie, there's a Jonathan who has his hand up there.
Oh, hi, Jonathan. Hi, Jonathan.
Hi, I'll take this down first before I say. Okay, yeah, hi. Okay, I know this hasn't. I haven't heard the questions yet, but two different questions. I know they said that it's either the mask or the face shield, if I remember right. It's called. If you're wearing the face shield, the first question is, do you think the mask is still necessary?
Really good question, Jonathan. Yes, it is necessary. So the face shield is okay protection in the sense that it protects your face from your eyes particularly, but it doesn't fit snugly around your nose and mouth. So when you're talking, you can still, or coughing, you can still expel those droplets. You can still give out those droplets. So that's why public health is saying the first thing we need to make sure is to wear those masks. And then if you want, or if you need to, then you add the face shield. But the most important thing and the first thing is the mask. And then you might see people, for example, in healthcare, in the hospitals, they have to use extra protection because they're in the hospital with people who aren't well and vulnerable. So they use extra protection. You'll see them wearing masks and face shields.
And okay, I don't know if this is an easy question or not. Even if you live in the same address, do you think the mask really is necessary if you and the other person sitting next to you are at the same address?
Another really good question, Jonathan. So if you're in the same home as somebody, they've been calling it your bubble, which is kind of cute. So it's your bubble that you and that person are close. You're probably safe unless one of you has been put at risk of having the infection. Then if one of you is identified as, maybe you went to a medical appointment or you were hospitalized and came out of the hospital back home, usually they would do a COVID test, for example. If you've gone to the hospital and you've been there for a while and you had to go back home, to make sure that you're safe to go home. Some people may still test positive for COVID and have to be at home, because we don't want people to stay in hospitals when they can be more comfortable at home. But then the other people at home have to isolate, or the person has to isolate away from the other person, the other people at home. So it really depends, Jonathan, that it depends on if things are safe and both of you are okay, you haven't been told that you have symptoms that might be COVID, you haven't tested positive for COVID, then you're in that bubble together, right? But if one of you develops symptoms or has tested positive, then you may have to isolate, even within the same home, which would mean people do the social distancing. The person might have to stay more in their room, their own room, and they may have to wear the mask as well if they're coming out and going to medical appointments, for example. Yeah, does that help?
Yeah, and I'll see if someone else asks something that I might have thought of. I'll wait till the end to see if someone else asks the same thing I might ask.
Okay. Okay. Were there other questions? Oh, I see Herb.
Yes. Hats off to all the nurses and doctors that are working continually, doing a great job trying to get this COVID on the best. And my question is, if I look at a needle, I faint. Is there beds available for people who faint if they see a needle?
Oh, well, that's good. It's good to tell. It's good when you're in a clinic that might have needles in that clinic or in the hospital. It's good to tell them ahead of time that you might faint if you see a needle. Sometimes carrying, like I have a one-page document, easy read document about myself. It's called About Me, actually. And I take that with me to hospital visits. And right off the bat, if it's somewhere I go often, they have that on file. And it says everything about me. And when I'm calling ahead to make appointments, sometimes I might remind them about things that they need to know ahead of time. Like if I'm going to a lab and that's something that makes me, seeing needles makes me faint, I would tell the person at the door, look, just be careful. Or I'd tell the nurse or the lab technician, be careful because I might faint if I see a needle. It's good to tell them ahead.
Yeah.
Thanks.
That's what I usually do is I let them know that I can't see the needle, otherwise they'll be picking me up.
Oh no. Oh
and
no.
that has
Sorry.
happened.
Uh-oh.
Yeah. Okay, thank you, and keep up with the good job.
Oh, thank you so much, Herb. Thanks. Looks like we have time for one more. Anybody else with a question?
I do. I have to go for a colonoscopy on Friday, and I haven't had the shot yet, so I'm really worried about the risks and everything because I'm kind of walking into a hospital. I don't know how safe or how so that's really concerning for me.
Yeah, so that's a good question, Kevin, because a lot of people feel that way, that they want to avoid hospitals. But I would reassure you that with the hospitals and the medical clinics and the dentists, they're taking so many precautions that they do. It's called infection control, where they are very often wiping down surfaces. They all have PPE on, and like I said, they don't just have the regular masks that we have in the community. They have super special masks, and then they wear the face shield. They change their gowns. They have to hand sanitize very often. As soon as they've gone into a room, they hand sanitize before going in. During being with the person, they may hand sanitize, and then when they leave the room, they hand sanitize. So in a way, I feel safer walking into a hospital or a clinic than I feel going to the grocery. I mean, I love going to the grocery. I have to go and I love it. But I'm extra careful to do my PPE and my hand sanitizing when I'm responsible only for that, right? And I'm out in the community. When I go into a hospital, I know that it's not just me. There's a whole team of people that are responsible for making sure that people don't get sick. So they are ultra careful at wiping down things and making sure people stay safe. Does that help?
Yeah, it does. I want to thank you for your expertise, and please be safe. And thanks everyone for the questions and information. That was very helpful
Oh,
and
thank
great.
you. Thank you. Thank you. And
Yeah.
I'm very, very, very pleased to be here and to meet people, meet everyone. So thank you very much. And just reassuring you that yeah, everyone also stay safe and we're going to get through this.
Okay. Thank you. Have a good day. We thought we would end our webinar series with a little bit of comedy. It's been a tough year for people, and laughing a little bit always feels good. We have Dean Jenkinson here today. He is a professional comic, television writer, and the executive director of the Winnipeg Comedy Festival. Thanks, Dean, and take it away.
Well, thank you very much, Kevin. Thank you so much, everybody. I'm not going to lie to you people. I am very nervous. I have not been able to get on stage and tell jokes in front of people for a long time, and there's so many eyeballs on me. I feel like I'm leading a rural Manitoba COVID worship service. This is wonderful. But when the organizers asked if I would join today to share a few minutes of jokes, I said, absolutely, I would love to, because if there's one word that I think sums up the last 12 months, it's funny. It's just been one hilarious moment after another, hasn't it? Today, no word of a lie, it is the 1-year anniversary to the day of my children being sent home from school for the first lockdown, with all the homeschooling and the 24-hour parenting. And I did the bread baking that a lot of people did because I wanted at least one thing in my house that was self-raising. But today we're talking about masks, or as I like to call them, face cummerbunds. It's formal wear for your face. Just think of it that way. I think what strikes me most about masks is how quickly they went from being something that felt so foreign and so strange to something that now feels just like completely expected. You know, I feel like if I were, God forbid, the victim of a home invasion tonight, the thing that would make me feel most violated is if they weren't wearing masks. I'd be like, sure, take the flat screen. I don't care. But for gosh sakes, quit breathing on everyone, you monsters. I used to have nightmares where I'm at school or I'm at work and I'm naked. Do you ever have those bad dreams? And now I have nightmares that I'm at Tim Hortons without a mask. That's where we're at. I would feel more comfortable shirtless at Tim Hortons than maskless at Tim Hortons. That's where we're at. You know, it used to be you'd get arrested at a bank for wearing a mask. Now you get arrested for not wearing a mask. I'm waiting for the news headline about the first guy who has both arrests on his record. Right? A few years ago, he walks into a bank wearing a mask, gets arrested. Now he walks into a bank without one. I feel like that would be the same kind of person. I feel like that guy's coming. I remember 1 year ago, the first time I left my house in a mask, I went to the grocery store for the first time. I remember being in the store. I remember being panicked, not because of the mask, not because I was afraid of the virus, but because everyone in the aisle was social distanced behind me, waiting for me to keep it moving along. And I can't open a produce bag without licking my fingers, and I can't lick my fingers. Have you been there? You're just sitting there going, everybody just hang on, hang on. But now a year later, I've got it all figured out. What I do, I just like swipe a finger across an eyeball and then I can, no, I don't do that. Don't do that. But my favorite thing about masks, I think, is just observing people, right? The different people and their different mask habits. Judging people, that's what I'm saying. I like judging people. Have you ever seen the guy with the masks hanging from his rear view mirror? Like they're air fresheners, right? Because nothing freshens your car interior like fabric steeped in your stinky breath. I like seeing the guy who wears his masks in the car. He's wearing a mask driving alone in his car so he doesn't give COVID to himself. I like that guy. You ever see the guy with the big lumberjack beard? I like that guy. He's got the mask over top of the beard, just kind of holding it all in. He looks like a porcupine wearing a G-string. I like the people with the face shields. I see people with the face shields. They look like a welder who doesn't take their eyesight very seriously. Or they look like someone who's been kicked out of too many salad bars and now they have to wear a court-ordered sneeze guard. I like seeing the guys walking around with their nose sticking out. Do you see those people? That drives me nuts. It's usually a grumpy looking guy. And ironically, it's the kind of grumpy looking guy you would see telling young people to pull their pants up. Isn't that the guy you always see with his nose sticking out? My favorite, I like the women who wear the homemade masks with the fabric from Fanny's, right? Some of them are bedazzled. They're beautiful. I see these women and I love them, but there's part of my brain that's saying, what about all the quilts that are not being made right now because 55-year-old women are busy making masks? Has anybody thought that the world is staring down the barrel of a massive looming quilt shortage and we're not talking about it? But I'm grateful to masks. I'm very grateful to masks. Masks have saved my life, I'm sure. And not just from COVID, that too. But I remember this one time I was at the grocery store. There was this big guy, big, strong, muscular guy. He's being kind of a jerk to everybody. And my mask prevented him from reading the horrible things I was mouthing. Saved my life. I'm grateful to masks for teaching me that my ears are far more sensitive than I ever imagined. You ever get I have the ears of a newborn with a sunburn. I'm grateful to masks because I think for the first time in my life, after a long day out in the world wearing a mask and I come home and I take it off, I feel like for the first time I understand what it's like for a woman at the end of the day to take her bra off. I feel like I have an appreciation of what that must be like now. Just, oh my gosh, this is wonderful. Oh, I'm just going to let this breathe for a while. I like keeping up to date on the studies. I like reading in the newspapers and listening to the radio about the news about the masks. I saw there was a study yesterday. They said that patients trust their doctor more when their doctor wears a transparent mask. And apparently they trust their doctors the least when they wear a Donald Trump Halloween mask. It's not a good medical expert. They say now that 2 masks are better than 1 mask. I wonder, is that really something we needed scientists to tell us, though? Are we that far gone in our critical thinking that we need evidence that, I don't know, 2 coats of paint are better than 1, that 2 sweaters are warmer than 1, that 2 towels are more absorbent than 1? That's why I don't have any time for people who are anti-maskers. They're not interested in like facts. They're not interested in the truth. I think what they're interested in is being arrogant, right? They're interested in being different from everybody else. They're interested in not doing what they're told. They'll say things to you like, oh, you're just being a sheep. You're just being a sheep, they say. And I think, what is wrong with being a sheep? The sheep that stick with the flock, they live. They're okay. That one sheep who thinks he's smarter than the rest, he says, I'm going this way. You guys, meh. He's not coming back except for maybe in a wolf's stomach. So as I wrap up and I say thank you to everyone who spoke, and thank you for having me here, and thank you for listening to my silly observations about masks, let me say, be responsible, be kind to each other. I am a big believer in karma. I do think what goes around comes around. So I know if I treat somebody very, very poorly, they had it coming. So thanks, you guys. I appreciate you being here. Have a wonderful day.
Thank you, Dean. That was very funny. That brings us to the end of today's webinar, our last one this winter. Thank you all for thank you for joining us. Thank you to Amanda and Stephen for sharing your perspectives. Thank you to Danny for your awesome video. Thank you to Angela for your expert answers and information. And thank you to Dean for making us laugh today. I hope you all heard some good ideas that will help you put you first and stay healthy. Just remember that if you have any questions about COVID or your health and safety, please talk to your doctor first. Find out what is best for you. Thank you, everyone. Have a great day.
Thank you, Kevin.
Thank you.
Thank you, everyone.
Thank you.
Thank you.
Thank you for inviting me, People First of Canada. It was nice talking to you guys.
It's great having you.
You were a good presenter.
Oh, thank
You
you.
made me feel comfortable.
You were good,
Yep.
Kevin.
We'll talk later.
All right, have a good
Take care.
Dean, you're very funny. Bye.
Yeah.